Hi, my name is Anja Segli and I would like to share with you what I found out about the nosocomial infections. A nosocomial infection is an infection that develops in a patient while the patient is hospitalized. The patient did not come into the hospital with that infection. The infection is normally defined as an infection that is identified between 48 and 72 hours following admission. So infections are incubating but are not clinically present yet. Nosocomial infections can also occur in other healthcare facilities like nursing homes, outpatient care such as day surgery, dialysis, or home patient therapy. Earlier research showed that at least 5% of patients became infected during hospitalization. But due to the increase of invasive procedures, at least 8% of patients now acquire nosocomial infections. Urinary tract infection, surgical wound infections, pneumonia, and bloodstream infections are the most common nosocomial infections. Skin infections, infections of the gastrointestinal tract, and infections of the central nervous system are also found, but are less common. There are several ways to contract nosocomial infections. For example, a surgical procedure increases a patient's risk of getting an infection in the hospital. Surgery directly invades the patient's body, giving bacteria a way into the normally sterile environment. An infection can be attained from contaminated surgical equipment or from contaminated healthcare workers that did not follow simple hygiene rules. Frequently washing hands is a must for healthcare workers and visitors and is necessary to avoid passing infections of microorganisms to hospitalized patients. Another nosocomial infection is pneumonia, caused by bacteria and other microorganisms that are brought into the throat by respiratory procedures commonly done in a hospital. The microorganisms come from contaminated equipment or the hands of healthcare workers. The introduced microorganisms quickly colonize in the throat, where they grow and form the colony, but have not yet caused an infection. Once the throat is colonized, it is easy for the patient to inhale the microorganisms into the lung and develop pneumonia. These are just two ways how a nosocomial infection can happen.